Finding a job. Health services, as we know, is a fast-growing employment area because of baby boomers. The employment of LPNs is projected to grow 21% between 2008 and 2018. In the area of nursing homes, skilled or intermediate facilities, rehab, residential care, developmental disability, medical surgical units, assisted living, home health, hospice care, critical care and emergency departments. Those that work in critical care and emergency departments are more likely to have military history. So let's look at different interpersonal styles. There are 4 different interpersonal styles that are used to achieve rapport. There's the analytical type. These people are highly detail-oriented. They can make difficult decisions without having all of the facts. They're very perceptive, but they may tend to be a little pessimistic. The driver type tends to be blunt, objective-focused, hard workers. They make quick decisions. They're very independent, can-do type people. The amiable type like to be liked. They're easygoing. They're not big risk takers. They tend to blend in. They're very sensitive. They have difficulty making firm decisions and can be quiet and soft-spoken. The expressive type are natural salespeople and storytellers. They're gregarious and they have good motivators. They tend to exaggerate and they often leave out some facts and details. They are very relationship oriented. To make a good impression on people, you need to listen to what they have to say. If you disagree with someone that you want to maintain good rapport with, use artful vagueness. In other words, responding to another's comments without implying that either one of you is wrong. As a student, I hope that you have been doing some networking. I've mentioned to my clinical groups that the performance that they put in at the clinical site is a type of a job interview. It's letting those people know what type of worker you are and if they're someone that they want to work with. So as you're networking for references, you can use your instructors, but make sure that you ask for permission when you use anyone as a reference. Unit managers, supervisors, team leaders, staff RNs, and LPNs make good references, as do school placement personnel. When you're networking for a job, let people know that you're looking for work. Ask for job leads and names of contacts. Networking should be a never-ending process. So different networking sources can be family and friends that have nursing contacts, former healthcare employers, newspapers, nursing journals, and school alumni offices, and the internet. Now, an informational interview is something that you are going to be required in this class to complete. It allows you to find out about a facility before you ever decide to put in an application there. There are big advantages to doing informational interviews. For example, a student did an informational interview at one facility that she really thought she wanted to work at following graduation. But when she went in for the informational interview, she was so disillusioned by the facility that she chose to not put in an application there because it was not a place that she would be proud to work at. How do you search for employment openings? There's a lot of different ways to do this. Different steps to enhance employment opportunities include displaying a positive attitude with your clients, seeking the supervisor's input on how to begin your career, work on building relationships with peers and key people where you do work, getting involved in facility and professional organizations. There is a hidden job market, and that basically means that there's a job market out there that people don't, or the employers don't necessarily put out an ad in the paper or publication for people to come in. It may be a job that is just word of mouth. You can get into the hidden job market with assistance from family and friends, employee recommendations at a clinical site, submitting direct applications to employers, searching company websites by using terms such as careers, employment, jobs, etc., state job service or workforce centers, using internet job sites such as careerbuilder.com, using private employment or recruiter companies, searching state or federal government websites, school placement offices and attending job fairs, etc., volunteer activities and professional associations, etc. Also, you might consider contacting the state nurses union and asking about employers who are hiring. Once you graduate and receive your license, you'll start receiving the Kansas State Board of Nursing newsletter that also has several job openings listed within it. So how do you fill out an application? There's definitely some tips and pointers. Most of all, make sure that you're truthful in the way you fill out your application. If you've left a job, make sure that you put the reasons for leaving, especially if you were not at that job for very long. If there's any questions that you wish to defer until the face-to-face interview, write N/A for not applicable, will discuss, or even leave the space blank. You should never specify a dollar amount under the wage accepted. Be aware that you do not have to answer questions about your age, religion, marital status, number of children, physical data, unless they are specific requirements for the job, workers' compensation, injuries, or criminal record, unless it is related to theft, assault, or the use of drugs. So when you're getting ready to go to the interview, what do? Well, I've prepared a list here for you. Make sure that you know when you're preparing questions to ask the interview what you want to know about the job opportunity and the facility, and practice responses to likely questions. So, for example, when an interviewer asks you to tell you a little bit about yourself, make sure that you stay focused on professional experience and your educational program and not personal things. Different interview questions and answers within your book. With my book, it's pages 308 to 310. There's a lot of sample responses and typical interview questions there. With silence, let there be silence. Don't think that silence has to be filled. Again, honesty is definitely your best policy. So some of the questions that might help you learn more about the position would be, what type of clients will I be working with? Will I be floated to other units? What type of charting system do you use? How is scheduling handled? What is the nurse to patient ratio? What type of uniform do you require? And if I want to work overtime, will it be available? There's many recommendations throughout this chapter in your book that regard interview tips and your appearance. But just to touch on some of the highlights, with your personal hygiene, make sure that you've taken a bath. Make sure your hair and nails are clean and neat. No nail polish. Avoid excessive perfume or aftershave. And make sure that you do not have bad breath. Dress professionally and conservatively. Keep your makeup to a minimum and be very conservative. Wear simple jewelry only. Make sure that you walk tall and sit erect in the center of your chair, and keep your hands inactive. In other words, no thumb twiddling. Don't interrupt the interviewer or rush the interview. Maintain eye contact. Don't make negative statements. Do not, never mind, I'm repeating there. A firm handshake is essential. And people like a good, strong, firm handshake. They don't want one of the limp-wristed lady handshakes. Make sure that you arrive at least 5 minutes early and shut off your cell phone. When the employer enters the room, stand up, smile, and extend your hand for a firm handshake. Address the employer by their surname. In other words, don't call them by their first name. And thank him or her for the opportunity to interview, whether you decide during the interview this is a place that you want to be employed at or not. Make sure that you don't chew gum or smoke. And remember that smoking prior to the interview can cause you or your clothing to retain odor, and that can be really offensive. You should politely refuse any offers of coffee, tea, or cigarettes. So think about it. If you were the nurse manager, who would you hire? Someone wearing jeans, cowboy boots, and a 10-gallon hat? Or a man who is in a suit but has stringy, unkempt hair and a beard? Or someone who is wearing a suit, is clean shaven, and is wearing a shirt and a tie? You do need to be aware that if you are pregnant when you apply for a job, that you should wait a couple of months before disclosing the pregnancy unless it's extremely obvious. When you are ready to talk about your pregnancy, be prepared to discuss how long you plan to work before taking off, how long you intend to be gone, and how your work will be covered while you're away. Expectant mothers are going to have both good and bad days during the pregnancy, and remember that friends can be a big help. There might be some pre-employment examinations or screenings or checks that need to be done. So a job offer may be conditional until you have passed a physical, a drug screen, or a background check. With drug screening, be aware that although drug screening accuracy is improving, it is not always 100% accurate. There are false positive drug results that can occur if medical conditions such as a kidney infection or disease, liver disease, or diabetes exist. So think about some of the common foods and medications that can cause a false positive drug result. After the interview, that very same day, irregardless of whether it's a position that you want or not, or you feel like you've got the position or not, you need to sit down and write a thank you letter to the interview. It demonstrates your interest. If you make a call to the employer to find out if you have, if they've made a decision regarding the position, understand that it's no longer only up to the employer to notify the applicants. So try to make it a practice to make a follow-up call But don't make the follow-up call on Monday, because Mondays are traditionally full because of staff meetings, weekend concerns, discipline issues, paperwork catch-up, and other duties. The best time to make a follow-up call will be after 9 a.m. And the key to a successful follow-up call is to be courteous but firm with the secretary. There's an example in your book, and once again, in my book, it's on page 314. If you find that you must resign from a position, it's really important to try to work at least a minimum of 1 year. It can be acceptable to leave a job within 3 months in certain circumstances, but those jobs should not be listed on your resume. Make certain that when you do leave a job, you should be respectful, and don't cut your ties with that particular facility. You never know when you may want to go back to work there. Resignation courtesy is giving 2 weeks notice, and always present a resignation letter in business format on plain paper, and keep it very, very impersonal by keeping personal frustrations and complaints out of the letter.